The world of viruses is vast and ever-changing. These microscopic entities have plagued humanity for millennia, often emerging from the shadows to cause widespread illness. In 2001, a previously unknown virus joined the ranks of these infectious agents, Human Metapneumovirus, or HMPV. Scientists discovered HMPV while investigating a series of respiratory illnesses that baffled doctors. The discovery of HMPV highlighted the complexity of respiratory illnesses, which are often attributed to more familiar viruses like influenza or the common cold. Yet HMPV proved to be a distinct entity, capable of causing a range of respiratory symptoms, particularly in young children. Its emergence underscored the need for continued vigilance in identifying and understanding new viral threats. As researchers delved deeper into HMPV, they uncovered its subtle yet significant impact on global health. The virus, once hidden from view, was soon recognized as a common cause of respiratory infections worldwide. Its discovery marked a turning point in our understanding of respiratory illnesses, revealing a previously unrecognized player in the intricate dance between viruses and the human immune system. Human Metapneumovirus often announces itself with a repertoire of symptoms that mimic the common cold. A runny nose, cough, and sore throat are frequently the first signs of infection. These initial symptoms can be easily mistaken for a mild cold, leading many to dismiss the illness as a passing inconvenience. However, HMPV can manifest more aggressively in certain individuals, progressing to more severe respiratory symptoms. Wheezing, shortness of breath, and difficulty breathing can signal a worsening infection, particularly in young children, older adults, and those with compromised immune systems. In these vulnerable populations, HMPV can lead to more serious complications like bronchiolitis or pneumonia, requiring hospitalization and specialized medical care. The challenge lies in distinguishing HMPV from other respiratory viruses based solely on symptoms. The similarities in clinical presentation make laboratory testing crucial for accurate diagnosis. Unfortunately, testing for HMPV is not as routine as testing for influenza or COVID-19, potentially leading to underdiagnosis and a lack of awareness about the true burden of this ubiquitous virus. In recent years, a surge in HMPV cases has gripped several countries, raising concerns among health officials and researchers alike. China, India, and the United States have reported significant increases in HMPV infections, particularly in young children. This surge has placed a strain on healthcare systems already grappling with the ongoing burden of respiratory illnesses. The reasons behind this recent surge are multifaceted. One contributing factor is the easing of COVID-19 restrictions, which inadvertently reduced the circulation of other respiratory viruses, including HMPV. As societies return to pre-pandemic levels of social interaction, HMPV seized the opportunity to re-emerge and spread rapidly through susceptible populations. Climate change may also play a role in the resurgence of HMPV. Fluctuations in temperature and humidity can create favorable conditions for the virus to thrive and spread. Furthermore, increased air pollution, often exacerbated by climate change, can weaken respiratory defenses, making individuals more susceptible to HMPV infection. Human metapneumovirus spreads through the air, carried on tiny droplets expelled when an infected person coughs or sneezes. These respiratory droplets can travel up to 6 feet, potentially infecting anyone within their trajectory. Close contact with an infected individual, such as sharing a household or being in proximity for an extended period, increases the risk of transmission. But the virus doesn't just travel through the air, it can also linger on surfaces, lying in wait for an unsuspecting hand to pick it up. Contaminated objects, such as toys, doorknobs, and phones, can become vehicles for transmission. Touching a contaminated surface and then touching one's eyes, nose, or mouth provides a direct pathway for the virus to enter the body. Good hand hygiene is paramount in preventing the spread of HMPV. Washing hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating, can significantly reduce the risk of infection. If soap and water are unavailable, hand sanitizer containing at least 60% alcohol can serve as an effective alternative. Section 5. Vulnerable populations. While human metapneumovirus can infect people of all ages, certain groups are particularly vulnerable to its more severe effects. Young children, with their developing immune systems still learning to fight off infections, are at increased risk of developing serious complications from HMPV. Infants under 6 months of age are especially susceptible as their immune systems are still immature. Older adults, particularly those over 65, also face a higher risk of severe HMPV infection. As we age, our immune systems naturally weaken, making it more challenging for our bodies to combat infections effectively. Underlying health conditions, such as heart disease, lung disease, or diabetes, can further compromise the immune system, increasing the likelihood of serious complications from HMPV. Individuals with weakened immune systems, regardless of age, are also highly vulnerable to HMPV. This includes people undergoing chemotherapy, those who have received an organ transplant, and individuals living with HIV/AIDS. Their compromised immune systems struggle to mount a robust defense against the virus, making them more susceptible to severe illness and prolonged recovery times. Section 6. No quick fix. Currently, there is no vaccine available to prevent human metapneumovirus infection. This lack of a vaccine highlights the need for continued research and development to protect vulnerable populations from this potentially serious respiratory virus. Scientists are actively exploring potential vaccine candidates, but the development process is complex and time-consuming. Similarly, there is no specific antiviral treatment for HMPV. Treatment primarily focuses on managing symptoms and providing supportive care. Rest, fluids, and over-the-counter medications to relieve fever and congestion can help alleviate discomfort. In severe cases, hospitalization may be necessary to provide oxygen therapy, mechanical ventilation, or other life-saving interventions. The absence of a vaccine or specific antiviral treatment underscores the importance of prevention. Simple measures, such as frequent hand washing, covering coughs and sneezes, and avoiding close contact with sick individuals, can significantly reduce the spread of HMPV. These preventive measures, while seemingly small, can have a profound impact on curbing the spread of this ubiquitous respiratory virus. Section 7. Simple steps for protection. Preventing the spread of human metapneumovirus relies heavily on breaking the chain of transmission. One of the most effective ways to do this is through diligent hand hygiene. Washing hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating, can significantly reduce the risk of infection. Covering coughs and sneezes is another crucial step in preventing the spread of HMPV. When coughing or sneezing, use a tissue to cover your mouth and nose and immediately dispose of the tissue in a bin. If a tissue is not readily available, cough or sneeze into your elbow rather than your hands to minimize the spread of droplets. Avoiding close contact with sick individuals is also essential in preventing HMPV infection. If you or your child is feeling unwell, it's best to stay home from work or school to avoid spreading the virus to others. Limiting exposure to crowded places, especially during peak respiratory virus season, can also reduce the risk of infection. Section 8. The path forward. Despite the recent surge in cases and the lack of a vaccine or specific treatment, there is hope on the horizon. Researchers worldwide are working tirelessly to unravel the complexities of human metapneumovirus and develop effective strategies to combat its spread. Clinical trials are underway to evaluate potential vaccine candidates and explore novel antiviral therapies. Advancements in diagnostic testing are also crucial in improving our understanding of HMPV epidemiology and developing targeted interventions. Rapid and accurate diagnostic tests can help identify HMPV infections promptly, allowing for timely treatment and implementation of infection control measures to prevent further spread. Continued surveillance of HMPV, both domestically and globally, is essential in monitoring its circulation patterns, identifying outbreaks early on, and informing public health interventions. By tracking the virus's movements, researchers can better anticipate and respond to future surges and outbreaks. Section 9. A shared responsibility. The fight against human metapneumovirus is a shared responsibility requiring collective action. Individuals, communities, and healthcare providers play vital roles in preventing its spread. Stay informed, practice preventive measures, and seek medical attention when necessary. Parents and caregivers protect young children who are most vulnerable. Ensure children are up to date on vaccinations to reduce respiratory illness risk. Teach children good hand hygiene and cough etiquette to prevent HMPV spread. Remain vigilant and adaptable in the face of infectious diseases. HMPV reminds us that the microbial world is evolving and we must stay prepared. By working together, we can mitigate HMPV and other infectious diseases.